Okay, thanks so much. As Wayne said, there's been a whole bunch of people involved in this project, and it's an ongoing project that started back at the start of COVID. So what I'm going to do today is present a bit of an overview of where we're at on this project so far, why we're doing it, some early results, and then what are the next steps. And I'd love some feedback, especially from some of the non-U of G people who are on the call. It should take about 10 minutes to get through, and I'm going to start with a little bit of an explanation about why I'm focusing on rural. And I think I might be preaching to the choir a little bit here, but ultimately it's because rural places and small communities, I would say, have been neglected. This neglect is a symptom of politics, voting seats, and population. While 82% of Canadians live in non-rural places, that leaves about 8.3, 8.4 million Canadians that are in those places. That being said, the vast majority of policy decisions are based on the experiences of the other 82%. I, for one, think it's critical, though, that everyone should be able to see themselves in policy, not simply those that live in Toronto, Ottawa, Vancouver, Victoria. Why? Because rural places are different, and not because they're better, not because they're special, but because they are different. The demographics in these places are different. Often there's a greater percentage of individuals who are older, so topics around mobility are particularly critical. We're also isolated digitally. We have a lack of broadband service, there's a lack of medical specialists, and of course, physically. COVID has brought attention to the implications of these factors on mental health of all Canadians, but the experiences of rural Canadians have been unique. The goal of this project, as it states there then, is to explore experiences of residents from rural and small communities across Ontario and across the country related to the ongoing COVID-19 pandemic. I imagine that many of us have heard the saying, if you've been to one rural place, you've been to one rural place. And sorry, Wayne, I know you're one of the people that say this, but I actually do not subscribe to this. It's important to recognize that while there are differences, there are far more commonalities between rural places. However, there are local nuances. Rural is not a monolith. Rural is not only agriculture, it's so much more. I, for one, have been brought up in rural, born and raised, live in rural now. I've never been inside of a barn. That does not make me less rural than someone who is an agricultural producer. Farming is important, but so are artisan shops, butchers, plumbers, and rural schools. We as rural Canadians need to have our voices heard, and the best way to get that voice out there is through reliable, valid data collection. We need to ensure that our opinions are heard and that the opinions that are provided are relevant. This process legitimizes our concerns, and by engaging with local populations, there is an increased sense of buy-in from the communities that are impacted. So here are the objectives. You can see that there's 5 objectives to this research project, and they were developed in consultation with an advisory group representing local residents, representatives of the NGO sector, local governments, health units, and so forth. Additionally, I personally reached out to almost every single organization across Perth and Huron, because that's where this project began, to have conversations to make sure that I was on the mark and I hadn't missed anything. So that includes Ontario Work, social service providers, immigration groups, ECDEV, ag groups, and so forth. And the idea is to ensure that these objectives not only make sense academically, but they resonate with the populations that I will be studying. So it was quite a long process. So what I'm going to do today is present some of the results from the early part of this study that occurred back in the fall. And what I'm going to draw from is a survey that was launched at the end of August 2020. And you can see kind of an overview. Maybe some of you even received the survey, but in the survey, there were 5 areas. The first is demographics, because I wanted to be able to say to Nancy's name is on my screen. So I wanted to be able to say to Nancy, these are the responses from females under the age of 40 who make less than 50,000, who are in the service industry, who rent their home. I wanted that level of granularity. The second component was individual well-being, and this was based on Canadian Index of Wellbeing indicators. You can see them indicated there. Social behavior, this is all about how we move, how we shop, and how we've changed, because ECDEV needs to understand how populations have changed and how we are not going to bounce back. That is not resiliency. Bounce back doesn't make any sense. Resiliency means to learn from and to adapt and then change and grow, much like we do on a day-to-day basis. The fourth is day-to-day living. Where are we anxious? Where are we worried? Friends, family, loved ones, but also our ability to pay our bills, keep food in the house, medication in the house, and so forth. And the last was planning and prep, because I think it's critical to be able to contribute to response plans for future disruptions. Each section was asked 3 times. We asked participants to self-assess their experiences with each question before COVID, since COVID, and then we asked them to look forward because we're really trying to paint a picture of how COVID has affected the experiences and the livelihoods of rural residents. There were 120 quantitative questions on each survey. We received 3,576 completed surveys. So we have this massive amount of data. And again, that's just from Perth and Huron. So let's get into some of that quickly. The first I want to highlight is well-being. There's no quantitative data here because that's not important. I want you to be able to see the trends. So we asked participants about their experiences around individual well-being before COVID, and you can see this is the responses. This is before COVID. This is after COVID, before, after. And all that matters here is that you're seeing trends. So if you look at the before, you can see the vast majority are in that good category, in the end, excellent or good. However, since the start of the pandemic, you see significant changes in where people's responses are falling. Okay, so that's just giving you some trend ideas. Now, then we asked specifically, we're going to talk about mental health today because mental health has received a lot of attention, but I would argue not enough attention. So we said, how has mental health changed since before COVID and since the start of COVID? And what you're seeing here is a 45% decrease in respondents who indicated excellent mental health, a 26% decrease in those who responded good mental health. And then on the other side, a 57% increase in those who said they have satisfactory mental health, and a remarkable 80% increase in those who responded poor mental health since the start of the pandemic. So now I'm trying to paint a bit of a picture about how COVID has impacted different indicators. Now, let's break this down by sex. I think everyone on this call should recognize that sex is one of, if not the most important indicators of vulnerability. Females are simply more often precariously employed. They're more often responsible for home and childcare, and generally they simply are paid less than their male counterparts. So what this slide is illustrating is the difference between self-reported mental health by sex. Starting with self-identifying females, there was a 42% decrease in that excellent mental health category since the start of the pandemic. On the flip side, self-identifying males, a 5% decrease. Okay, so 42 and 5, just to give you some of the ideas. Now let's flip to the other end of this, self-identifying females. We saw a 67% increase in females who self-assess their mental health as poor since the start of the pandemic, and a very concerning 70%, 71 actually percent increase in self-identifying males who said they now have poor mental health. Again, as it says, these are statistically significant numbers. We've ran all the stats tests, but again, I'm just trying to get through it quick to leave this open for some questions. Originally, I really thought this was going to be super interesting, the role of income. And the reality is no matter what income group you are in, you've been impacted. The caveat here is 50,000 and under, much more significant. And the second caveat is it's really difficult to ascertain income levels. If you ask a stay-at-home parent to respond to a survey about their income levels, almost unanimously, they include their partner's income. So there's a bit of a caveat here about we don't know if this is individual or household, but the key number is 50 and under. That's where there seems to be a very, very significant impact on mental health. Now, let's get into some age. We originally thought this was going to be less significant than it ended up being, but I think this is really important to talk about. The federal government, the provincial government has spent just a tremendous amount of time talking about the impact of COVID on seniors. Physiologically, that is critical to consider. The reality, though, is the mental health impact on females, males under the age of 40 is much more drastic. And so I want to tease this out a little bit more, and this is females. And what we're seeing here is a 95% decrease in females under the age of 30 who self-assess their mental health as excellent since the start of the pandemic. Again, under 30, self-identifying females, a 95% decrease in that number. Males are very, very significant as well, but just simply not as significant. It's about a 75% decrease. And this is just to really drive home that one category. If you are a female under the age of 40, you have been statistically significantly impacted by COVID, much, much more than any other cohort that we can tease out. And so my advice here would be to make sure that our services and our responses ensure that we're not just blanketing self-identifying females as a cohort. There's a need to make sure the source or the supports that we offer are tailored to the different demographics. And ending things, you know, I talked about why rural matters, but again, it's because rural is not a monolith. It's really critical that we get relevant, locally collected, reliable data out into the community, because those who advocate, so that those who advocate can access quantitative data to help them say, listen, this is our experience, this is what's happening, we need some support, and here's the data to back it up. I'm not an advocate. It's just not what my job is. My job is to conduct research. It's also not where my heart is. But that being said, I give talks all of the time with this data because there's so many different organizations that do advocate. And so here are some of the headlines from across the province of how the data has been used to secure additional funding. I was able to secure quite a significant amount of funding from OMAFRA. So we have started the process of expansion. We're going to go to at a minimum of 6 counties across the province. We're going to include some questions around vaccination hesitancy, childcare questions, as well as we're going to get into the qualitative component to ensure that the quantitative statistics are reflective of the qualitative descriptors and the realities that each community face. There's been a mess of people involved in this project. So here's kind of a list of everybody. I wouldn't have been able to do this without especially that advisory group there on the left. And of course, all of the different funders that have supported this project so far. Thank you very much. And I would love to have some questions.